Hello, everyone, and welcome to today's session on cooking with gas, the health harms from gas stoves. My name is Zach Williams, and I am the health educator and campaign coordinator for the Environment and Health program here at National Physicians for Social Responsibility. I'd like to thank you all for joining today's presentation, and a huge shout out to Kara Cook and the Alliance of Nurses for Healthy Environments for partnering with us on today's presentation and having you all come join us here. The session today will be about 45 to 60 minutes. We have a lot of content to cover, so I do apologize if I talk a little fast, but there will be a moment at the end for Q&A. And I will be sure to answer any and all questions that y'all have. First, some logistics about that. As I begin the presentation, please drop any questions you have during the presentation into the Q&A box, not the chat box. I will be going through all of those questions at the end of today's session during the Q&A moment. But if you have a comment trying to connect with someone, another participant, that you can feel free to throw into the chat, but please leave any questions for the Q&A function. If we don't get to your question today, please feel free to email me any and all follow-up questions following this presentation. I just dropped my email into the chat, and my email is also on the screen right now on the title slide. So if you have not already, although I'm pretty sure this is a formal seminar setup, so I think everyone should be muted already. If you have a question, you can please, by all means, throw your hand up and I will unmute you and you can ask it. And we can, of course, wait until the end of the session for the Q&A sessions as well, if you feel so comfortable. Okay, so first and foremost, here's just a pitch about who Physicians for Social Responsibility is. We were founded in the 60s with the slogan, protecting us from the greatest threats to health and survival. We have a national nonprofit founded by approximately 33,000 physicians, and we mobilize physicians and health professionals like nurses to advocate for climate solutions and a nuclear weapons-free world. We also contribute the desperately needed health voice to energy, environmental health, and nuclear weapons policy at all of the local, federal, and international levels. Just as a little bit of an outline and a table of contents for what this training is going to be, I've organized it through our 3 learning objectives. So by the end of today's session, you will be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each pollutant. You'll also be able to recognize and prioritize vulnerable and frontline populations, as well as understand why they are vulnerable. And you will be able to address the health effects of gas stove pollution and explain to patients the steps they can take to reduce their risk. Next is, this is a big long paragraph telling you about the CME and CEU accreditation. We are both physician and nursing CME and CEU accredited, so nurses can claim 1 CEU credit hour following this presentation, and there'll be instructions on how to do that at the end. And this is a slide promising you that I'm not trying to sell you anything. And before we jump right into the content, I have a quick favor to ask. There is a pre and post test for this webinar, so we can see learning achievement, and so we can report back to our grant funder how well we're doing. So if you could please either scan the QR code on the screen or fill out or click the link in the chat that I just dropped. This is a very short, it's 5 or 6 questions, multiple choice on a Google form, and you will get a post test at the end of the session with these same exact questions so we can see learning before and after. So if you could take 90 seconds to 2 minutes to fill that out, I would be eternally grateful. Thank you so much. We'll come back in the next, 90 seconds, 2 minutes. All right, we'll take another minute. and then we'll get going. Alrighty, folks, in the interest of time, I'm going to go ahead and get started again. Thank you so much for filling out that form. If you did, I really, really appreciate it. So I kind of hate webinars that are just 60 minutes of someone talking at you. So I do have a moment of audience participation here. Before we actually start learning, I have a question for you all. Please feel free to throw your answers into the chat or raise your hand and I can unmute yourself and you can share with the group. What's the first thing that comes to mind when you think of gas stoves? Anything and everything, just gut reaction, first thing that comes to your mind. Again, you can throw your answers in the chat or you can raise your hand and I will unmute you. The smell when using them, cheaper, smell, even cooking, smell, my preference over electric, to be honest, smell. All right, so we're smelling a lot of those odorants they add to methane so that you can smell when it's actually there. Did I leave it on? Ease of cooking, dangerous. Great. My preference for cooking, heats up faster, fast cooking. Great. Thank you so much, everyone. So we seem to have a great range of responses from positive to negative to kind of neutral connotations and feelings about gas stoves. What I think about when I think of gas stoves is that colloquialism we have in the United States, cooking with gas, the title of this presentation. You know, it's a positive thing. You know, your car won't start and then it finally turns over and now we're cooking with gas, you know, and that's due to, in large part, a lot of money and a lot of communications effort from the oil and gas industry for the past half a century to make Americans believe that gas is indeed the better, cleaner, faster cooking method than electricity, which may have been true in the 20th century, but now we have some great electric cooking options. So thank you so much for that. And without further ado, let's jump right in then. So no matter how you feel about gas stoves, the fact remains that when using a gas stove without ventilation, it produces dangerous indoor air pollution. This leads to the first section of this training, which is understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, including both PM 2.5 and PM 0.1, also known as ultrafine particulate matter, if you've heard that phrase before. These are not the only pollutants produced by gas stoves. They are simply the primary and most prevalent pollutants produced by gas stoves. So gas stoves produce many air pollutants, and these are the primary of them. And let's go through what each of them do to the human body. So let's start with nitrogen dioxide. Nitrogen dioxide is a harmful air pollutant that is produced by the combustion of fossil fuels, including the methane we burn in our stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility to respiratory infections. It is also associated with negative general cognitive functioning. Next, carbon monoxide is another dangerous gas, perhaps more well-known than nitrogen dioxide. Exposure to carbon monoxide can have neurological effects such as fatigue, impaired vision, dizziness, all the way to falling into a coma. For cardiac patients, carbon monoxide can also cause chest pain, and at high enough levels or at long enough exposures, carbon monoxide can also lead to carbon monoxide poisoning, which can be fatal. Lastly is particulate matter, both 2.5 and PM 0.1. PM 2.5 is any matter that is smaller than 2.5 microns in diameter, and ultrafine particulate matter, or PM 0.1, is any matter that is smaller than 0.1 microns or 100 nanometers. For context, particles that are smaller than 2.5 microns settle on the walls of our alveoli, where they then set off a cascade of inflammatory changes that can lead to heart and lung disease, and also decreased lung function. Ultrafine particles, which are smaller than 100 nanometers, are actually small enough to translocate directly into the bloodstream through either our lungs or our sinus vasculature, and then they distribute widely throughout the human body. They can cross the blood-brain barrier and can accumulate in brain tissue and be a risk for stroke. Both PM2.5 and PM0.1 can aggravate asthma, decrease lung function, and increase respiratory symptoms. It could also contribute to non-fatal heart attacks, irregular heartbeat, and premature death in people with heart or lung disease. PM has an asterisk next to it on this chart because the amount of particulate matter being produced while cooking is really dependent on what is being cooked in the pot or the pan. Fats and oils, olive oil, butter, margarine, sunflower oil, avocado oil, all of those things we use to pan fry foods produce the most particulate matter. So if you're frying an egg with some butter, you're going to have much more particulate matter if you were, say, just boiling water on a stove. However, particulate matter is still produced no matter what is being cooked. Just certainly higher levels are being produced when there are fats and oils being heated up. Now, this chemical is not included on this specific chart, but there has been new research recently in the past couple of weeks that also shows that gas stoves, when they are on and off, produce and emit a dangerous level of benzene, actually BTEX in general, benzene, toluene, ethylbenzene, and xylene, which are all, benzene particularly is a pretty bad carcinogen, and all of them are components of secondhand smoke. So these, of course, are the damaging pollutants that are coming out of your gas stove when they're on, but even when they're off, gas stoves are emitting essentially secondhand smoke into your kitchen 24/7 at all hours of the day. So with that lovely information, this is all of the bad things that happen to the human body from these pollutants, but how much are we actually breathing them in and how much are we actually being exposed to them? So let's look at some exposure data. On the left here, you will see the national standards and guidelines relating to NO2 concentration specifically. The United States does not have standards for indoor air pollution, so we use the outdoor standards as a reference. The US EPA national outdoor standard is 100 parts per billion, and the World Health Organization's indoor standard is 106 parts per billion. So this is a 1 hour average. So the EPA is saying, please do not be around a concentration higher than 100 parts per billion for longer than an hour, otherwise it is harmful. For context, 1 part per billion is like adding a single drop into an Olympic-sized swimming pool. So 100 may be a relatively high number, but 100 parts per billion is actually a pretty low concentration before NO2 becomes dangerous to our health. Data from the Lawrence Berkeley National Laboratory showed that in houses that were less than 1,500 square feet, indoor air levels of NOx exceeded EPA ambient air standards more than 83% of the time when people cooked with gas stoves without ventilation. And this goes up to 100% of the time in homes that are smaller than 1,000 square feet. That's a lot of words for an incredibly important point. So let me actually show you a graph to really solidify that. So this is a graph I took from the Lawrence Berkeley National Laboratory study, and I'm going to explain it a little bit, go step by step. Here on the y-axis is NO2 concentration in parts per billion, but they're not evenly spaced units. Here's 10, here's 100, here's 1,000. This is a logarithmic scale, so these are not evenly distributed units. On the x-axis is time of day, 8 a.m., 10 a.m., noon, 2 p.m., 4 p.m. And each of these pink shaded areas are when the researchers were either using the oven or using the range on that gas stove. And this house 3 is kind of the perfect storm of bad things when it comes to gas stove pollution. It's an older home. There's not access to ventilation, proper ventilation over the stove, and it is less than 1,000 square feet. The red line is the measured NO2 concentration in the kitchen, and the blue line is the measured NO2 concentration in a hallway or bedroom farther away from the kitchen. And as you can see, whenever the researchers were either using the oven or the gas range on top, here is 100 parts per billion. The EPA says, please do not be around this for long, any concentration higher than this for longer than an hour. It is dangerous to your health. And as you can see, with every single cooking function, the NO2 concentration in the kitchen skyrockets above 100 parts per billion, and it does not go down back to baseline. You turn it on, and then 2 hours later, you turn it on again, and it spikes again. and it dissipates a little bit, but not to zero, and it spikes again. So all of this is just trying to show you that yes, indeed, when you use a gas stove without ventilation, you are being exposed to dangerous levels of nitrogen dioxide specifically, and other dangerous levels of other air pollutants. So this is the exposure data, but what does that actually mean in terms of disease? So we're going to use childhood asthma as the lens to really look at the interaction between these gas stove pollutants and human health. So this is another study entitled Association of Changes in Air Quality with Incident Asthma in Children in California, 1993 to 2014. Very long title. All you need to know is that it's a multi-level longitudinal cohort study over 21 years. I'm not going to go into the nitty-gritty research methods of this, but essentially it's one of the best research methods we have to look at effects over time. And this wasn't over 6 months, 2 or 3 years. It was over more than 2 decades. So this is a very, very well thought out change over time study, looking specifically at what happens with air quality and new cases of childhood asthma. So let's look over here again on the left side on the nitrogen dioxide side. Each of these pretty colors is a different community in Southern California. The y-axis is asthma incident rate, so the amount of new cases of childhood asthma that Southern California is seeing. And nitrogen dioxide concentration is the x-axis, but pay attention, it's inversed. So it's high concentration over here, low concentration over here. And essentially what we're seeing is that as Los Angeles and Southern California in general got its act together, cleaned up the smog, cleaned up the ozone, cleaned up the nitrogen dioxide, as the nitrogen dioxide concentration decreased, so did the asthma incidence rate in children. So this is going to show you that when you decrease NO2, you also decrease the amount of asthma, incident asthma that you see, particularly in children. The focus on children here is actually important because this is a great segue to our next section, which is vulnerable and frontline populations. Children happen to be one of the most susceptible populations to air pollution in general, but also specifically gas stove pollution. And this is because of a couple different reasons. First and foremost, children have an increased breath rate. So they are breathing in these pollutants more so than adults. Next, children have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could actually be harmful for a child. And lastly, children's immature respiratory and immune systems are still undergoing development, so they don't have the ability to deal with stressors in the same way that adults can. While exactly how the mix of NO2, CO, and particulate matter and other gas stove pollutants affects childhood respiratory illness, that specific interaction isn't well understood. A meta-analysis looking at association between gas stoves and childhood asthma found that children in homes with gas stoves have a 42% increased risk of experiencing asthma symptoms, a 24% increased risk of ever being diagnosed with asthma, and an overall 32% increased risk of both current and lifetime asthma. This suggests that the multiple pollutants, the soup of pollutants that's coming out from burning gas, this soup together poses a higher risk to children than if it was just NO2 alone, which is the important point here for gas stoves. It's not just NO2, it's this soup, this mix of air pollutants that is coming out when we burn methane to fry eggs in our homes. Now, I want to continue the conversation about vulnerable and frontline populations and continue to use childhood asthma as the lens to discuss things here, but I also want to talk about this in the context of environmental justice. Not every child is equally exposed to gas stove pollutants, and thus the distribution of childhood asthma is skewed. The data I'm about to show you comes from the National Center for Environmental Health and the Journal for Urban Health. I won't go through each prevalence data point, but I just want you to see from the numbers on this slide that in terms of, let's say, housing type, 21.8% of children living in public housing have asthma compared to just 7.38% of children living in private residences. In terms of race and ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that of white children. And lastly, when looking at income level, 11.8% of children living below the poverty level deal with asthma, compared to just 5.9% of children at 450% or higher of the federal poverty level. So, living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, one of the most prominent health effects from gas stove use. And why is this? So to fully understand why being a person of color and of low socioeconomic status puts you at higher risk for respiratory illness in the United States, we have to look back at our history. These are examples of why environmental racism and why redlining exists today. This is not a fully exhaustive list as to why there is environmental racism in the United States. This is simply a smattering of examples. So first and foremost, federal housing and transportation policies essentially codified racism into the economic and geographic development of the United States in the mid-20th century. The Federal Housing Act of 1949 authorized the demolition of Black neighborhoods, and the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods that were labeled as urban slums and replaced them with the nascent interstate highway system. This not only severed communities, which were most often Black neighborhoods, but also constructed long-term polluting transportation infrastructure next to, near, or simply through communities of color. Secondly, although it's outlawed today, many majority Black neighborhoods are still reeling from the effects of redlining. Redlining is a homeowner's loan corporation categorization strategy, where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages or other types of loans. These neighborhoods were outlined in red on their maps, hence the term redlining. However, redlining now refers to lending discrimination that bases credit decisions on the location of a property to the exclusion of characteristics of the borrower or the property. In the post-Civil War era of Reconstruction and through the first half of the 20th century, the Great Migration took place, where millions of Black Americans moved from the South to northern cities for economic opportunity and to escape the horrors of the Jim Crow South. In response to this influx of new Black residents, many cities across America used redlining as a policy and a housing practice to keep cities segregated and to keep Black folks out of white neighborhoods. Redlining prevented investments in infrastructure, green space, public transportation, business development, and all other aspects of city planning that make for a successful, prosperous, and healthy neighborhood. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. And when I say lack of political will, that is certainly not on the part of the citizenry, that is on the part of the people who are in seats of power and have the power to turn the levers and simply don't. Now, environmental justice is not just about addressing racism. We can take an even deeper dive into environmental justice and look at another key facet, which is class and socioeconomic status. This is a health equity issue, and low-income households are at higher risk of being exposed to high levels of gas stove pollution. This is for a myriad of reasons. First and foremost, smaller unit sizes. It's important to remember that homes that are less than 1,000 square feet exceed the EPA ambient air standard 100% of the time when you cook on a gas stove without ventilation. Along with smaller unit sizes, there are also usually more people per home than higher income households. So not only are more folks using the kitchen, but also more folks are breathing in that pollution that is produced in the kitchen. Next, low-income families are also more likely to live in older homes or have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted in years and may even still have a pilot light and are more likely to have inadequate ventilation over the stove. The pilot light bit is important because although most gas stoves nowadays use a sparker mechanism, the click, 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 click when you turn on your burner, some older ones still have a pilot light, which means that there is methane burning constantly in your home at any given moment of the day. It's great and convenient when you want ramen noodles at 2 a.m., but that also means that there is nitrogen dioxide, carbon monoxide, and particulate matter being emitted into your home 24/7 if there is a cooking appliance with a pilot light. Next, low-income homes are also more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source for heat for relief, which is typically their kitchen oven, which does the job. It heats the home and provides relief from the cold while also pumping the home full of air pollutants while providing heat. Next, low-income homes are also more likely to have higher exposure to outdoor pollution for all the reasons we've already talked about already. Redlining, the nascent interstate highway system, NIMBYism, pushing the power plants, the treatment plants, the sewage plants out of wealthier, wider neighborhoods. And eventually the NIMBYism stops when we get to a low-income neighborhood who does not have the political or economic capital to push the industrial assets farther away from them. Next, and finally, low-income homes are also more likely to have a greater asthma burden, making them more sensitive to lower levels of nitrogen dioxide than someone who was not around ambient air pollution and who does not already have an asthma burden. So that's a lot of depressing information that I just threw at you. But before we get to the solutions, because we never present a problem without a solution, I have another break for us, another moment for audience participation. I feel our eyes glazing over a little bit. So again, you can throw your answer in the chat, raise your hand and answer to the group. But have you seen any of these issues in your patients, in your friends, your family, your loved ones, yourself? Have you ever noticed that when you use a gas appliance, your throat might get scratchy, your wheezing might start, you feel a little lightheaded. Certainly everyone has smelled the odorants that they add to the methane to make sure that it's there. So yes, please, by all means, have you ever seen any of these issues? And I see home care nursing, saw people using stoves for heat. It's sad and true that a lot of folks in these situations, either in public housing or in housing situations where the landlord isn't properly taking care of the property, the stove and the oven is a wonderful source for heat. It is just, an open flame burning fossil fuels in the home at the same time. Not yet. No, I've had to use it for heat once, knew it was bad, but my heat was out. You got to do what you got to do, Relief from the cold is important. Alrighty, folks. HUD study in Baltimore years ago found that 20% of residents were using gas ovens to use them for heat, which is a horrifying statistic. 1 in 5 folks living in HUD housing developments had to use that gas oven for heat. So thank you all for responding. Grew up in a home with gas, used heat for some times. Not HUD housing, all housing, pardon me. An even better statistic about gas stoves and who has to use heat. We lived in a row home, poor ventilation in the kitchen, few windows from the house, sure thing. Thank you so much, folks. So this is not my personal story, but I will tell my coworker's personal anecdote. One of my colleagues in our San Francisco Bay chapter during one of these trainings shared a story where, she lives in the Bay Area, it gets cold in the winter, and every winter when their gas furnace would turn on, her wheezing and her asthma symptoms would get very, very bad in the house during the winter. And she just attributed it to, it's the dry air, it's winter, it's allergies, what are you going to do? And as soon as they changed from a gas furnace to an electric heat pump, which does both heating and cooling all throughout electricity, her asthma and wheezing went away during the winter. And so she finally put 2 and 2 together that, oh my goodness, it was the gas furnace that was giving me all of these wheezing symptoms. And as soon as I changed to an electric heating appliance, they went away during the winter. Again, not my personal anecdote, and it's anecdotal evidence, not experimental evidence, but another example of how, fossil fuel pollution in our homes can affect us. I've used gas ovens for heat, live in a very own home, no insulation. Exactly. If the home doesn't have insulation or proper insulation, the gas stove and the gas oven is probably going to be where a lot of the heat comes from. So thank you so much for sharing, everyone. And now so that we get to the meat and potatoes of today's session, are solutions. So before we actually get to what you can do either in a room with a patient or when in your own kitchen for your own family and your own self, I want to talk about solutions for a minute. To properly address this complex health issue, the solution must be multifaceted and systemic. First and foremost, the solution should address the target health effects patients are experiencing and should be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment that the patients are living in and should aim to improve the quality of that environment. The intersection of these three core aspects is the ideal, perfect situation. However, we all live in reality where things are hardly ever perfect. So to that end, let's explore some solutions we can take as healthcare professionals and as individuals to reduce either our exposure or our patients' exposure to gas stove pollution. So first and foremost, just like any medical issue, it will be risk assessment and then risk management. So first and foremost, we've already talked about some at-risk populations, but here's a laundry list of some more. Children we've already talked about, but of course on the other end of the age spectrum, the elderly are more susceptible to air pollutants. Folks living with diabetes, folks of low socioeconomic status, people living with obesity, and people with pre-existing heart and lung conditions. Next are some lifestyle and behavioral risks that could put you at risk for either being exposed to more air pollution or feeling the effects of air pollution more. So when I say hobbies, I mean, like, do you run in an area with high air pollution? Do the things you do for fun and enjoyment put you in a space where there is high level of air pollution? Ventilation, do you have access to it and do you use it if you have access to it? I rent here in New York City and I have a gas stove and I do not have a proper ventilation over my stove. It is merely the fan in the microwave above it that, you know, increases airflow and spills it out over my head to the rest of the kitchen. But that at least is puts it closer to the window that is there and it's better than nothing. Smoking. If you smoke, obviously your lungs are going to be more degraded than a non-smoker and you're going to feel these effects more so. Do you use fossil fuels inside the home? Do you even have a gas connection? If your building is already all electric, good job, you're done. That's the end goal of this presentation and the building electrification field in general. But if you do have a gas connection and use fossil fuels in your home, you're of course going to be exposed to more fossil fuel pollution than someone who doesn't. What is your time spent in heavy traffic and in-car behaviors? Do you commute every day? Is it a 2-hour slug back and forth? Are you sitting in the parking lot of an interstate or an intercity highway? That, of course, is going to, the car exhaust is going to be breathed in and degrade your lungs a little bit more than someone who does not commute or is not in transit often. And of course, if you live near an industrial or a fracking site, there's going to be higher levels of ambient air pollution due to those, which will also degrade your lungs and make you more susceptible to this pollution, feeling this pollution. Next, let's talk about risk management. First and foremost, when we're at the patient level, address the health conditions. I do not need to tell y'all how to be nurses. Y'all absolutely know how to do your jobs. So, you know, if the kid doesn't have a rescue inhaler, get him a rescue inhaler, you know, essentially treat and manage the symptoms and the health effects that they are feeling. And also keep in mind, everything that I've talked about so far has been pretty vague, you know, coughing, wheezing, headaches, dizziness, lightheadedness. How do you know if that is fossil fuel pollution or any of the other myriad of things that it could be? And this is just a reminder to keep in the back of your mind that when you see symptoms like fatigue and headache and sinus congestion and cough, these can be caused by low levels of exposure to carbon monoxide and other volatile organic compounds. So it's good just to, in the back of your mind when you're doing an assessment of a patient to, you know, if they present with these respiratory vague symptoms and some neurological effects, it might be worth asking about a gas connection in the home. When you're not in the room with a patient and it's more policy level that you're looking for, I highly advocate for y'all to either join, or if you already have joined, to urge your state medical and medical specialty societies to formally recognize the risk of health of asthmatic children to cooking with gas in the home. A lot of medical societies and medical organizations across the country have already acknowledged this. The American Public Health Association has a statement on gas stoves. The American Medical Association just last year passed a resolution regarding gas stoves and asthmatic children. So the ball is rolling, the snowball is rolling, and it could get even bigger. And I highly advocate that you urge the societies you're a part of to raise awareness among doctors and nurses by developing and distributing guidance and intervention recommendations. And raising your voice is one of the most powerful acts a health professional can take as a trusted member of their community. Because as we've seen over the past couple of years, people don't tend to listen to the tree huggers or the enviros, but they'll listen to their doctor, they'll listen to their nurse, they'll listen to their health professional that's coming in and taking care of them. Next, working with local, county, and state legislators. Being a politically active citizen is also one of the best routes you can take as a health professional, just because, like I said, people tend to listen to health professionals. You can contact your local, county, or state legislators and ask them about any electrification bills or decarbonization policies that are on the table for the legislative season, and voice your support and actively support these legislative electrification efforts as a health professional will add the desperately needed weight to the movement and hopefully start to push some electrification policies through local governments. An example of how this happened is in the state of Washington. It started locally in the cities of Shoreline, Tacoma, and I'm forgetting one of them, but 3 cities in Washington state changed their building zoning codes thanks to pressure from the health community to have no new gas connections in any new construction past 2030. And Governor Inslee liked that so much that he made it a statewide policy. So now any building, high density residential or commercial, built in Washington state after the year 2030 will not have a gas connection for heat or energy, which is great. So if this comes through your city, your county, your state, I highly advocate for you to raise your voice as a health professional and say, yes, indeed, we would like this. So now you're just in your kitchen. That's what you can do with the patients, but what can you tell your patients to do, or what can you do in your own kitchen to reduce your risk of gas stove pollution exposure? I'm going to go through each of these bubbles real quick. So first and foremost, install and maintain a carbon monoxide detector. Most of us probably do already have some, but through this work, I've learned that those carbon monoxide detectors really only go off when it's carbon monoxide fatal level poisoning. It's saying, please leave the area right now. It's a bad time. I would suggest getting one that would go off at a lower level of carbon monoxide so that you are at least aware that your carbon monoxide level is rising to damaging but not death levels. So you can turn on your fan, open a window, start to get that airflow going to ventilate a little bit. Next, if it's available, just like I said, run your exhaust hood while you cook. I know it's loud. I know it's annoying. I know it's a cacophonous noise, but this really does help in ventilating and getting airflow going in your kitchen in terms of right above the gas stove. This is actually not a great picture because this should be lower, and it should also be covering the entirety of this range, not just the back burners. Because I'll jump down to this one, as you can see, cook on the back burners. I've also learned that when you cook on the front burners of your gas range, and have your exhaust going, even if the exhaust is going, the pollutants are much more likely to spill out into the kitchen than to get caught by the exhaust hood. So it's recommended that you cook on the back burners because then the pollutants are much more likely to shoot up into the exhaust hood. Next is probably my favorite because it's free 99. Open a window while cooking. This is not a perfect solution. It will certainly not clear the kitchen of all of the air pollution, but it's the simplest and easiest and probably the easiest to remember to do. If you are turning on your gas stove, open up your window. If you turn on your oven, open up the window. It is the simplest form of airflow generation, but it's better than nothing. Now, I realize I might be a little biased as a lifelong New Yorker with opening the window being my favorite one, because if it's wildfire season, I can understand why you didn't want to open your window. If there's a hurricane, I understand why you didn't want to open your window. If it's -4 below in Minnesota, if it's 104 in Phoenix, I understand why you wouldn't want to open your window. But if you have the ability to, I would suggest the simplest, easiest solution, half solution, is to open your window while you cook. Now, ultimately, what we want to do is reduce the amount of time that that burner is actually on in general. So I would advocate for using countertop plug-in, plug-out appliances like air fryers, toaster ovens, kettles, anything that can perform a cooking function with electricity that you don't have to turn your gas stove or oven on for. If you're looking for that pan fry function that is not, acquired in a toaster oven or an air fryer, I would also suggest getting one of these plug-in, plug-out electric induction burners or stovetops. Single ones go for about 60, double ones are about 110, 120, but it's a cheaper solution than an entirely new kitchen appliance, and it does get that pan fry function going without fossil fuel pollution. Now, to address the root cause of kitchen fossil fuel pollution, you have to replace the kitchen fossil fuel appliance ultimately, which is why we advocate for switching to an electric or an electric induction stove. Now, I'm going to give a little spotlight to the induction stove real quick because there's a myriad of reasons why it is the better option than a gas stove. First and foremost, it's electric, boogie woogie woogie. There is no indoor fossil fuel pollution when you use an electric induction stove. Now, indoor is doing a lot of work in that sentence because I do understand that the majority of electricity generation in the United States comes from the combustion of fossil fuels. So there is fossil fuel pollution near your power plant, but there is no indoor fossil fuel pollution when you use an electric induction stove. Next, it lowers household accident risk because of how induction works. Induction, as opposed to conduction, which is how gas stoves work, a flame, a hot source is in direct contact with a material, and that material heats up the pot or the pan. Induction works through magnetism. So there is a wire underneath this glass or ceramic covering, and an electric current is put through that wire. That electric current generates a magnetic field around the wire, and if you have a pot or pan that is material that a magnet can stick to, it can interact with that magnetic field, and the resistance of the particles in the pot or the pan to the magnetic field is what makes the pot or the pan hot. So only the pot or the pan is going to get hot, not your entire appliance. So if you have a little one who's touching, grabbing in the kitchen all around, and they go up and touch the stove, their hand isn't going to get burned. Don't let them touch the pot or the pan. That's going to be hot. But their hand won't be burned because the entire appliance does not get screaming hot. This is also great for commercial kitchens where the workers and chefs and barbacks and dishwashers in that kitchen are constantly exposed to incredibly high temperatures and also incredibly high levels of air pollution. So this can also help bring down the temperature of commercial kitchens to help with labor rights and help with labor health a little bit. And next, it's an investment in your family's health. I know not everyone is made of money, especially not right now with COVID and inflation, and most Americans have fallen on hard times. Replacing an entire appliance might not be high up on the financial priority list, and it might not even be possible for renters. However, like I said before, there are some single and double burner induction options that are cheaper than replacing an entire gas stove. And if someone's child is having a hard time breathing at home, increasing induction cooktop use and decreasing gas stove use can provide some relief, while larger scale, longer term systemic work is done to either provide financial opportunity to replace that appliance or decrease air pollution in your locale in general. Now, that is not a perfect solution because, just like I said before, new research has just come out in the past couple months showing that even when a gas stove is off, it is emitting the same pollutants found in secondhand smoke. So we highly advocate, if you can and if it is possible, rip that gas appliance out of your kitchen, shut off the gas connection, and replace it with an electric induction stove so that no air pollutants are coming from that appliance in general. Now, I want to end real quick with a little teaser for something that is being touted as a solution, but certainly is not. And that is hydrogen blending. And this is a wonderful opportunity for health professionals to raise their voice in their local or county politics as well. So first and foremost, what is hydrogen blending? It is the epitome of greenwashing, essentially. Without going into the weeds of it, gas companies are proposing to blend hydrogen gas, which is made from fossil fuels, with methane gas. This is essentially to reduce the amount of methane that they have to use and frack, and replacing that with a percentage of hydrogen gas. It's bad for the climate, and it's more explosive than methane and emits more NO2. So not only do we have to frack more methane to then use that methane to produce hydrogen to put back in the methane gas supply, which does not make sense logically, it also produces hydrogen and methane together produce more NO2 than if it was just methane burned alone. And it's more explosive. Hydrogen and methane together is more explosive than just methane on its own. So it's bad for the climate and it's bad for our health. It is the epitome of greenwashing. And if this comes across your local utility is proposing this shiny new toy of hydrogen blending, they're going to pilot it in your state or your county, please raise your voice and say, absolutely not. This is not what we need to do right now to reduce our greenhouse gas emissions. If you would like to get more into the weeds of that, I just dropped a link into the chat. PSR just dropped a new report detailing the dangers of hydrogen blending. Hydrogen does have its space in the green transition. You can't run a shipping container ship off a Tesla lithium-ion battery. We need hydrogen as a fuel source for large-scale cargo transport. And just like Lucas said, green hydrogen is not greenwashing. Blue, gray, brown, and pink hydrogen are all greenwashing. Hydrogen blending is greenwashing. Green hydrogen, unfortunately, only makes up less than 1% of hydrogen generation in the United States. And even if all green hydrogen projects were to come online, it would take up all of the renewable energy from the renewable energy infrastructure that we have already created and still need some to be built. All of this to say, hydrogen blending isn't great and we shouldn't allow hydrogen in our homes. Only allow it on shipping container ships. So with that, thank you so much for sitting here and listening to me talk at you for 60 minutes. If you could, please, I just dropped the link in the chat, or you can scan the QR code on the screen right now. It is the post-test to this session. It is the same questions as the pre-test, and also there is a couple of how'd we do, rate us 1 out of 5, what was your favorite, what was your least favorite part of this. We're always looking to improve these webinars, so your feedback is greatly appreciated. So please, if you could take a minute or two to fill that out, that would be great, even if it's an hour or two after this session. I do want to continue real quick because I want to be mindful of time and get to questions. This is just a smattering of some of the work that PSR and our chapters across the country have done in the building electrification space. The PSR Washington chapter really has done a lot of great work in terms of changing building zoning codes, which is ultimately where we'll have to go to prevent new gas connections. But we've also done work getting PSAs about gas stoves on local NBC affiliates. Our Greater Boston chapter helped write the text that was passed by the Massachusetts Medical Society, then the Northeast Regional Medical Society, and then ultimately the American Medical Association's statement on gas stoves and health. And PSR Pennsylvania has done some wonderful work with environmental justice and making sure low-income homeowners and renters have access to electric options as well. If this has lit a fire under your butt and you really want to get involved in things like this as a health professional, please feel free to join us at PSR. We have a special program called the Climate Ambassador Program, where you will get to work hand in hand with national PSR staff members on issues relating to climate change, renewable energy, and environmental policy. We have 2 programs, one for folks who are well into their career and possibly retired health professionals, and for folks who are students or just emerging in their health professional career. So please take a look at that. I just dropped the links in the chat as well. If you are here for CEU credit or CME credit, you can scan that QR code on your screen, or I also just dropped a link into the chat right there. It'll ask you to create an account for USF Health, who is where we get our accreditation from. But you will also receive a follow-up email from me with instructions and links and everything we've talked about today in case you missed this, but you still want to claim credit. And with that, thank y'all so much. Stay safe, and let me jump to these questions. So to honor my promise, I will start with the Q&A questions first, and then we will jump to the chat. So let me actually stop sharing my screen. There we go. Okay, folks. So are your clinicians available in Boston to speak with me? I will answer you personally, Virginia, about that. Great, let's see. Donald, doesn't just the process of cooking food on any range create some hazardous emissions? Yes. Whether you cook food on an open gas flame or propane or electricity or induction, the process of cooking food is going to produce particulate matter, particularly when we use fats and oils. That's just the nature of cooking. The gas stove does produce additional hazardous materials like NO2, carbon monoxide, benzene, toluene, ethylbenzene, and xylene. The particulate matter, though, will be emitted whether or not it is gas or not. Thank you for asking that. When you say a gas stove produces while off, are we assuming there's a pilot light? No. So, Sarah, to answer your question, the pilot light certainly does mean that there is pollutants being emitted while it's off. But this study from PSE Healthy Energy, based out of California, essentially what they did is they put a bag, they put a plastic bag over a gas stove, a new gas stove with a sparker mechanism, not with a pilot light, and they just let whatever emission come out of the gas stove while it's off over a period of, I don't want to lie to you, I don't know if it was a couple hours or a day or whatever, but they found in 99% of the gas stoves that they sampled had dangerous levels of benzene and higher percentages as well of toluene, ethylbenzene, and xylene. So the gas stove, when the gas stove produces pollutants while it's off, that does not necessarily mean that there's a pilot light. It's just the nature of a gas appliance. Alrighty. Thank you so much. Julia, you might address this, but I'm curious how much running an air purifier with a HEPA filter will undo the harm related to of gas stove related air pollutants. Now, Julia, I don't want to lie to you. I am not an air purifier expert, I do have to say. But if that air purifier has some kind of experimental evidence that says, yes, it does filter out particulate matter, it's probably hard to filter out the NO2 and the carbon monoxide. But for at least particulate matter in general, if an air purifier does that job and there's experimental evidence and good reviews of it, I would say it wouldn't hurt. You know, an air purifier in every room in your house wouldn't hurt, but I know that's not feasible. But certainly an air purifier in the kitchen could help. Let's see, Stephen, concentrations of many emissions and air pollutants during the time of the study, correct? Doesn't this confound the NO2 asthma causality? Stephen, if I am assuming correctly, concentrations of many emissions and air pollutants during the time of that study. Stephen, I will respond back to you personally, just so we can I want to make sure I answer the correct graph for you. All right, from Anonymous, what is the reason for BTEX emissions even when the stove is off? Great question. I think it has to deal with the soup that exists in our natural gas pipelines. It is mostly methane, but there is certainly room for other air pollutants to be mixed within the natural gas supply. The exact reason why it's BTEX coming out of the gas stove, that I actually don't know. I will link the PSE Healthy Energy study to the follow-up email as well to do some deeper dives. But I don't want to lie to you. I don't know the exact specific reason why BTEX forms in our natural gas supply. All right, then another anonymous question. Same risk harms related to gas wall heaters as well, same gas mixture. Thank you for this question. So everything I've talked about today, for the exception of probably when I'm talking about pan frying things, all of the pollutants that I've talked about today come from methane. It's not just the stove thing. So if you have any appliance that runs off methane, a gas water heater, a gas furnace, a gas fireplace, a gas stove, any appliance that uses gas is going to produce these same pollutants just by the chemical nature of what happens when you combust methane. So yes, it does apply to other appliances, not just stoves. Pardon me. Terry, is this information geared only towards stoves, or would propane natural gas heating be included? So yes, that just like I said, propane is a different chemical structure than methane, but it is still a hydrocarbon, and it has similar chemistry when combusted to methane. Propane is dense, so if it leaks, it goes to the ground. So it's dangerous for, animals, pets, and little ones who are crawling still. But the information is still relevant for anything that is fossil fuel or hydrocarbon combusted as a function. Alex, is it safe to assume that renewable natural gas will also have the same health effects as traditional natural gas? Yes. Renewable natural gas is a wonderful, wonderful marketing and PR term for methane gas. It's RNG, it's methane gas. It could be recycled, however they want to try and frame it and market it as. But natural gas is natural gas, whether or not what adjective is put in front of it. Yes, the health effects would be the same for renewable natural gas. From Catherine, not a question, but the cost of electricity is so much more than the cost of gas, therefore is more financially friendly to use gas versus electricity. So thank you for this, because this is a reality, is that a lot of folks do tend to use gas because it is the cheaper option relatively to electricity. And this is where we get into advocacy for community solar and decentralized solar and increasing our renewable energy distribution, but locally, like distributed solar energy, where you can generate your own solar energy, your own energy. But if you don't, and you do buy electricity from your utility, there are some great studies that show that ultimately the cost is recouped in terms of medical costs and adjustments and gas hikes and gas price hike, I should say. But you're not wrong in saying that right now in some places, gas is cheaper than electricity. And sometimes the financial concerns just take place as the health concerns, and that's reality, no judgment here. I would advocate, though, if you could go to electricity, that would be great. Helen, is hydrogen blending the same as what they call renewable natural gas? No. Hydrogen blending is taking hydrogen gas, which is produced 99% of the hydrogen produced in the United States right now is something called gray hydrogen, which is made from steam methane reformation, which essentially means they put methane gas under incredible amounts of pressure to break apart the molecule and capture the hydrogen gas itself. So they use fossil fuels to get hydrogen, and then they take this hydrogen and put it back into the methane gas supply, which is, the math ain't mathin' right in my head when it comes to reducing greenhouse gas emissions and reducing emissions, because you have to use fossil fuels to get the solution to reduce fossil fuels. But ultimately, no, it is not the same thing as renewable natural gas. They might try to use hydrogen blending in the renewable gas process, but hydrogen blending is the process of taking hydrogen and blending it into the methane gas supply. Another anonymous question, did they do the same sampling of stoves not connected to a gas line? Was the BTEX for materials in the stove? That I do not know, anonymous, that's a good question. Another anonymous question specifically related to the BTEX PSE Healthy Energy Study. So don't you worry, folks, that will be linked directly into the follow-up email with the slides. I have some fact sheets coming your way, the CME and CEU credit instructions. So study will absolutely be linked there. All right, so we definitely are over time. I see that there's a bunch of more questions in the chat. So unfortunately, I don't think I'll be able to get to all of them, but please feel free to email me your question. If I didn't get to it today, again, I will drop my email right into the chat right now. Please feel free to email me. I would love to have a conversation with about all of your questions that you have today. And please feel free to look for a follow-up email from me regarding with the slides, with the fact sheets, with everything under the sun that we've talked about in every link I've dropped in the chat. And again, thank you so much to Kara Cook and the Alliance of Nurses for Healthy Environments for having me today. Thank you all so much for being here and listening to me talk at you for 60 minutes, more than 60 minutes. And I hope you all have a wonderful, wonderful day. Thanks, y'all.